This year, we know for families, the child care issues, the financial issues, so many challenges for families.
Yeah, and parents there are worrying that how are their kids doing with COVID-19? How are they doing with social distancing, with distance learning, with hybrid learning? So World Mental Health Awareness Day is on Saturday, and here to give us a little mental health insight for families is Dr. Sarah Jurstad with Jurstad, a pediatric psychologist at Children's Minnesota. Good morning, Dr. Jurstad. We appreciate you being here.
Good morning.
Yeah, so why don't we just start with how are kids doing? What are you hearing from kids about the effects of the pandemic?
Kids in general are really struggling with this pandemic. The pandemic has taken a significant toll on the mental health of most kids, at least to some degree. We know that anxiety and stress tend to increase when people feel like they do not have a sense of control or they don't know what's expected, and that is the general state of things with this pandemic. For kids who are doing distance learning, they have the added difficulty of not being able to have the regular social connections that they normally have. So not having those interactions with peers at school, or not seeing teachers or coaches, or being involved in the activities that they normally do. And for kids who are doing hybrid or in-person learning, they do have more of those connections, so that's positive. But many of those kids are worried about their increased risk of exposure to the virus. And just in general, school does not look like it used to look. Kids are wearing masks, there's social distancing, there's not as many activities, so kids are just grieving what school used to look like.
We know that kids struggle with anxiety and depression. What does it look like, though? How does it manifest itself in children?
So what we see with kids is we see increased sense of isolation. We see kind of distancing from their families. We see some behavioral struggles with younger kids. So younger kids may not be able to tell their parents that they're struggling, but they're going to see some acting out and some behavior changes.
So what can parents do if they are recognizing these signs here?
Parents can take a tip from this year. They need to they need to kind of think about a new normal. Last year, things were different. It was a crisis. This year, parents need to really create a structure. They need to create a daily routine for kids so that they can have a sense of predictability. The other thing that parents should be doing is just checking in with their kids' mental health on a regular basis, see how they're coping. Parents should also be looking at their own mental health, and so they should be taking care of themselves and getting the support that they need, because we know that when parents are functioning well, that their kids are going to do better.
Right. I mean, and I think that's a lot of things that parents are really taking heart, is understanding that they need to take care of themselves so they can take care of those kids. For kids that even before the pandemic were struggling with depression or anxiety, is this just magnified for them now?
Absolutely. So kids who have had mental health struggles previously are at greater risk right now. For example, kids who struggle with depression are more likely to be isolated, so they're not going to get the social support that they need. And kids who have anxiety just have more to be worried about. Kids with ADHD are going to have trouble staying focused, especially when they're doing that distance learning and sitting in front of a computer all day, or even when they're doing hybrid and trying to keep track of the schedule, they can feel disorganized. And many of these kids before the pandemic got their mental health care through the school system. So one of the big concerns is that they may not have the access that they had before to getting the mental health care that they need.
And there are resources out there for these children. We'll be sure to put those on our website if you're interested, and this is something you see in your children. Dr. Sarah Jurstad with Children's Minnesota, thank you so much.
Thank you.